Our next founder is aiming to make health insurance more simple. Founder and CEO of a company called Better, Rachael Norman will discuss building a business around the aim of finding the money that your health insurance owes you. Please welcome Rachael Norman to the stage.
All right. Good morning, everybody.
Hi.
Lots of people very early on the last day of the conference. Who here lives in the United States? All right. There are a few of you. This is mostly pertinent to you, although this problem does happen elsewhere in the world. So what we're working on is the uniquely problematic issue of getting money back from your health insurance. So in the United States, we have a phenomenon going on where fewer and fewer healthcare providers are taking insurance. It's too expensive and too time consuming. It's a horrible process for them. And when they stop taking insurance, what that means is that individual human beings end up being their own medical biller. And so they have to go through this painful process of faxing, mailing, filling out forms that are wrong and impossible to find, and then hoping that they get some money back. With us, we've created a simple app that makes this a 30-second process. So signing up for our app, it's as easy as signing up for Lyft or Uber, and using it is as easy as using Instagram, except you don't have to pick a filter. And with us, you get money, which on Instagram, unless you're an influencer, far less likely. So one of the things that this does for people, besides getting them a lot of money back from their insurance, and for some of our users, their first time, they're getting $5,000, $10,000 back, is it takes the stress of dealing with all of this off their plate. That's often one of the things that people complain about the most, is how horrible it is to need this money to continue care, but not being able to actually get it back from their health insurance. So talking about our growth story, I founded this company because I was losing thousands of dollars every year. I was looking for the startup that was solving this problem, and unfortunately, there wasn't one out there. So I built it. And in 2016, what that looked like was me on the phone talking to insurance companies 12 to 15 hours a day and doing everything manually. And this year, our team has grown. We have some world-class engineers and designers working with us, and we're able to process tens of millions of dollars worth of claims. So we've gone from me doing everything in HIPAA-compliant Google spreadsheets to a really sophisticated system that helps people get money out of their insurance. And a lot of what we're solving with this, right, are things that a normal human being doesn't know to take care of on their own. So those are things like coding errors that we're able to correct. We still see healthcare providers that are using codes that have not been part of the coding system for over 5 years. So we're able to do a lot of cleanup and get the insurance companies actionable data so the claims go through the process much more seamlessly than they would if they were user submitted. We also are fortunate enough to be backed by some world-class investors. I joke that we're collecting Facebook trading cards because among our investors, the lead designer of Facebook, the first UX designer they ever had, and our brochures were designed by the first communications designer. So we're starting with a tremendous amount of support, and that's how we've been able to grow so much so quickly. And so for the handful of people in this audience that do actually live in the United States, I urge you to sign up and send us your claims. We process everything: medical, dental, vision, and pharmacy. And if not, please do check us out on social media. We talk a lot about broader healthcare issues in the United States. And one really cool thing that we're doing, which is using a portion of our revenue to actually buy and forgive medical debt. All right, thank you very much.